Kentucky Heart Walk is this Saturday at Keeneland.
And joining us this morning to tell us more is Andrea Ooten and Shorus Minella. Thank you so much for being here. Tell us a little bit about the walk.
Oh, thank you so much for having us, and it's a perfect segue after hearing about the Heart Safe Schools and Project Adam, because the American Heart Association is doing a lot of work with Project Adam as well, so it's really exciting to hear that that's happening. So we're thrilled to have Central Kentucky Heart Walk coming up this weekend at Keeneland on Saturday. I'm hoping for better weather predictions than what we're seeing right now, but really, yes, come on, Jim. But we're really excited about it. It's going to be a great opportunity for people to come out and celebrate our survivors and those that have gone on before us, and really as we are working to make a bigger impact in health outcomes throughout the state, learning different opportunities. We'll have UK Healthcare on site doing some CPR demonstrations, so that's an opportunity, as well as some blood pressure screens and that sort of thing as well. So,
and it's, when you come out there for the walk, you get a different look at Keeneland as a whole too. It's really neat, isn't it?
Yes, it is. So our route actually takes you on parts of Keeneland that typically people don't go on necessarily. So it is really beautiful, and you know, again, just a great opportunity to really commit to making healthier lifestyle choices and doing you know, better whenever it comes to exercise and eating healthy and all that sort of thing, which is really what Shorus is here to share with us today.
So tell us a little bit about why it's important to not only eat healthy, but just to make sure that we have some of those preventative measures so we don't run into any situations.
Definitely. So eating healthy prevents and can help heal you from any of those heart events that you've had. So I always tell patients to think small. So when you have a heart event, you usually think that I have to overhaul my diet, I have to go on this elimination diet, but really it's making small little changes like lean meats, whole grains, cutting back on the added sugars, and all those small changes really add up in the end.
And it is kind of easy to change a diet once you look at some of the figures, right? It's easy to make those changes,
It's
right?
really easy to make those changes. And that's one thing that I really educate my patients on. And I like to empower them and show them the importance of the little things that they can do. If you drink sodas, you know, if you drink 5 a day, cutting back to 3 a day, I see you looking at him, so maybe something we need to work on. But just cutting back and small changes and just working up really makes a big difference.
I'm excited about the Keeneland walk, especially because I haven't been on, you know, a lot of parts of Keeneland.
Yeah.
But I know we were talking about some preventative measures. You had some education out there. What else will you have out there?
So we're really excited that we're going to have our Kids Zone back in full force this year. So if you've got young kids or even teenagers, they'll have a good time. We'll have the fire department will be out there with us. We have Buckles, which is the mascot from Keeneland, will be there making an appearance. So good to know if your toddlers are not such big fans of people in costumes. But also we'll have Home Depot doing some different crafts and different things. So there's a lot for kids to do. So it's not just about coming out and doing the walk. It's also about coming out and really celebrating different things that we can all do together to live longer, healthier lives.
And how can we get signed up for this event?
Oh yeah, absolutely. So you can go to heart.org/centralkywalk, or you can just show up at Keeneland and we'll register you on site. It is a fundraiser for us, so if you register, you can put it out on your social media and raise money to support the Heart Association, which helps us as we go out into the community and do all kinds of different you know, community impact work with CPR or blood pressure, that sort of thing, and helps us fund research that hopefully will save lives in the future.
I think it is important, especially now talking about AEDs and Damar Hamlin. All of that has really brought us to really focus a lot on our health and our heart, and even having the children, you know, sign up for CPR classes and getting their AED training is very important. So I appreciate both of you being able to help us navigate through all of this, because it is confusing. But is there anything when we are trying to figure out our health, let's say, is there anything that happens prior to that, okay, this is a trigger, now we know that something else is going to happen? Is there anything like that?
Well, I think first, you know, if you have a primary care, go to your doctor, get all the necessary tests, get your blood pressure checked, making sure you stay on top of your blood pressures, normal blood pressures, and then exercise, really. Tying it all together to make sure that you prevent some of those things with exercise. Moderate exercise, 30 minutes a day, 150 minutes a week, not hours.
I know. We both. That's tough for both of us. Okay.
Minutes a week is really what you want to shoot for, and do something you love too. You're more likely to exercise when you're doing something that you really want to do.
Perfect. Thank you so much. I truly appreciate it.
Of course.
Thank you.
Thank you.